Growing older brings wisdom, experience, and the desire to stay healthy for as long as possible. That's why so many seniors faithfully attend every checkup their doctor recommends, believing each test will protect them. But here's the hidden truth. Not every medical test after 70 is helpful. In fact, some of the most common checkups can quietly put your health at risk. Recent studies show that up to 37% of medical tests in seniors lead to unnecessary treatments, anxiety, or serious complications. Even more shocking, nearly all older adults over 70 are unaware they are being over-tested. Something as simple as a scan or screening can set off a chain reaction, new prescriptions, more procedures, even surgeries, that were never needed in the first place. That's why this video is so important. Today, we're counting down the 5 health checkups seniors should think twice about after 70. Each one sounds routine and harmless, but research shows the risks can outweigh the benefits. You'll also hear real stories of seniors who faced complications, plus safer alternatives that protect health without unnecessary danger. Before we get started, drop a comment below with where you're watching from and your age. We love seeing our community from all over the world. Have you ever had a medical test or procedure you later regretted? Do you think seniors are being tested too much these days? We reply to as many comments as possible with personalized health tips and advice, so your story might help others too. And of course, don't forget to like this video, subscribe to our channel, and hit the bell icon so you never miss our weekly senior health updates. Stay with us until the very end, because the #1 test on this list has been linked to thousands of cancer cases every year, and yet it's still being marketed as preventive care. By knowing the facts, you'll be empowered to protect your health, avoid unnecessary risks, and focus on what truly keeps you strong. Number 5. Bone density scan. It sounds harmless, a quick scan, no pain, no needles, and you walk out with a number that claims to show how strong your bones are. But here's what no one tells you. After the age of 70, this test often creates more fear than benefit. The bone density scan, also known as a DEXA scan, is meant to detect osteoporosis. But in older adults, especially women, the results almost always show lower density even when there's no real danger. That's because bone loss is a natural part of aging, just like wrinkles or gray hair. The problem is that these results push many seniors into taking drugs they don't actually need. One of the most common prescriptions is bisphosphonates. These medications are designed to strengthen bones, but they come with serious risks. Side effects can include painful acid reflux, inflammation in the esophagus, and in rare cases, jaw necrosis, a terrifying condition where the jawbone literally starts to die. And the benefit? Very small. A study in the Journal of the American Geriatric Society tracked more than 1,200 women over 70. After 5 years, bisphosphonates reduced fracture risk by only 0.3%. That's almost nothing. Meanwhile, countless patients suffered through dangerous side effects that ruined their quality of life. Take Rose, a 76-year-old retired piano teacher. Her scan showed mild bone loss, so she was placed on medication. Within months, she developed severe reflux and jaw pain that stopped her from playing piano. Only when she switched to natural approaches, vitamin D, strength exercises, and calcium-rich foods, did her health recover. The truth is simple. For most healthy seniors over 70 who haven't had fractures, lifestyle solutions reduce risk more effectively than any pill. Don't let a number on a screen push you into fear or unnecessary treatment. Number 4. Brain MRI for memory loss. When seniors begin forgetting names, misplacing keys, or feeling more confused than usual, the first fear that comes to mind is dementia. To calm those fears, doctors often order a brain MRI, thinking it will provide clear answers. But here's the uncomfortable truth. After 70, these scans almost never give useful results. Most MRIs in older adults simply show normal age changes. Slight brain shrinkage or tiny white spots are common findings in seniors, but they don't necessarily signal Alzheimer's or any serious condition. The problem is, once those spots appear on a scan, fear takes over. Patients start believing they are sick, even when their memory is perfectly normal for their age. Worse still, these results often lead to a cascade of unnecessary tests. Seniors may be sent for spinal taps, invasive biopsies, or even brain surgery, all based on findings that have nothing to do with real disease. A major 2021 study found that 86% of older adults scanned showed abnormalities, but only 3% of those results were linked to treatable conditions. That means the vast majority of patients suffered stress and extra procedures for no reason. Take George, a 74-year-old retired engineer. His doctor sent him for an MRI after mild forgetfulness. The scan showed white matter changes and George panicked, convinced he had dementia. He stopped driving and isolated himself. But when tested with a simple cognitive screening, his memory was completely normal. With reassurance, better sleep, hydration, and brain exercises, George's memory stabilized without risky procedures. The lesson is clear. Unless there are severe neurological symptoms like seizures, sudden personality changes, or rapid decline, a brain MRI usually does more harm than good. A simple cognitive test is safer, cheaper, and far more effective at identifying real memory problems. Number 3. Cardiac stress test. The cardiac stress test is one of the most common procedures ordered for seniors who mention fatigue, mild chest tightness, or just not feeling as strong as before. It involves walking on a treadmill while your heart is monitored, or receiving medication that simulates exercise. It sounds like a smart way to detect heart disease, but for seniors over 70, this test often creates more problems than solutions. The biggest danger is false positives. In older adults, the stress test frequently shows abnormal results, even when the heart is healthy. Studies reveal that in people over 70, false positives can be as high as 40%. That means nearly half of seniors who take this test are wrongly told something is wrong. And once that alarm is raised, a chain of invasive follow-ups usually begins. These follow-ups often include angiograms or heart catheterizations, where a tube is threaded into the arteries. Many times, seniors are then given stents or even bypass surgery. While life-saving for people with serious heart disease, these procedures provide little to no benefit for older adults without clear symptoms. Instead, they increase the risk of bleeding, kidney injury from contrast dye, and long hospital stays. The evidence is clear. A 2017 study in JAMA Cardiology showed that more than half of stents placed after stress tests were done in patients who gained no survival benefit. Yet those same patients suffered complications that left them worse off than before. A safer choice for seniors without classic warning signs, like chest pain during exertion or severe shortness of breath, is a resting EKG or a coronary calcium scan. These are far less risky, more accurate, and avoid the cascade of unnecessary procedures. Sometimes, the best medicine after 70 is not another treadmill test, but focusing on hydration, gentle exercise, and lifestyle adjustments that truly protect the heart. Number 2. Colonoscopy after 70. For decades, colonoscopy has been considered the gold standard for detecting colon cancer. It uses a long camera to scan the colon and remove suspicious polyps before they turn cancerous. For middle-aged adults, this test can save lives. But once you pass 70, and especially after 75, the risks often outweigh the rewards. The first hurdle is preparation. Colonoscopy requires strong laxatives to completely clean the bowels. For seniors, this prep can cause dehydration, dizziness, or kidney strain, leaving the body weaker even before the procedure begins. Then comes sedation, which in older adults increases the chance of confusion, memory issues, or dangerous heart rhythm changes. The test itself also carries risk. Colonoscopies can sometimes cause internal bleeding or, in rare cases, a perforation, a small tear in the colon wall that can lead to life-threatening infection. A 2019 study in JAMA Internal Medicine examined more than 1.3 million Medicare patients over 70. The findings were alarming. For every 1,000 colonoscopies in adults over 75, only 2 lives were saved, while more than 20 people experienced serious complications. That's a 10-to-1 risk-to-benefit ratio. Consider Dana, a 73-year-old grandmother. With no symptoms and no family history, she was urged to undergo a routine colonoscopy. During the procedure, a tiny polyp was removed, but later that night she suffered a bowel perforation. 9 days in the hospital followed, and her health was never the same. What was meant to be preventive care turned into trauma she could have avoided. The truth is, after 70, safer options exist. Stool-based tests like the FIT test or Cologuard can be done at home, with no sedation or hospital risks. These simple screenings catch most concerning cases without exposing seniors to dangerous complications. Prevention matters. But after 70, safety matters even more. Number 1. Annual full-body CT scans. Full-body CT scans are marketed as the ultimate prevention tool, catching hidden cancers and silent diseases before they become serious. Some private clinics even sell them as executive health packages, making them sound like a smart investment. But for seniors over 70, these scans are not only unnecessary, they can actually cause the very diseases they claim to prevent. The main danger is radiation. A single, full-body CT scan delivers the same radiation as around 500 chest X-rays. According to a 2023 study in JAMA Internal Medicine, the rising use of CT scans may now be responsible for up to 5% of all cancers in the United States. That puts routine CT scans in the same league as daily alcohol consumption as a cancer-causing risk. Then there are the incidental findings. CT scans are so detailed that they nearly always uncover harmless nodules, cysts, or calcifications, normal parts of aging that pose no real threat. But once they appear on the scan, doctors often feel obligated to investigate further. This triggers more scans, biopsies, or even surgeries, creating fear and exposing patients to life-threatening complications. Take Marcus, an active 80-year-old who felt perfectly fine. After a full-body scan at a private clinic, a tiny lung nodule was detected. It turned out to be harmless, but only after a PET scan and a needle biopsy. The biopsy collapsed part of his lung, leaving him hospitalized for 2 months. A man who was strong and independent suffered serious harm, all from a test he didn't need. Experts now agree, full-body CT scans should never be used as routine screening for healthy adults. If symptoms appear, like unexplained weight loss, persistent coughing, or unusual pain, then targeted imaging makes sense. But scanning the entire body without reason is more likely to shorten life than extend it. Finishing the countdown doesn't mean seniors should ignore their health altogether. The lesson is not to stop testing, but to choose smarter, safer alternatives that provide real benefits without exposing you to unnecessary danger. The good news is that many of these options are easier, cheaper, and far less risky than the tests we've discussed. For bone health, instead of rushing into a DEXA scan and harsh medications, seniors can focus on vitamin D testing, fall risk assessments, and regular balance evaluations. These steps help doctors target actual risks, rather than numbers on a chart. Simple strength and mobility checks often predict fracture risk better than a scan ever could. For memory concerns, a cognitive screening test is a safer first step. This paper-based exam quickly assesses attention, recall, and problem-solving skills. Unlike an MRI, it avoids panic, unnecessary procedures, and huge medical bills. If serious red flags appear, then more advanced imaging can be considered. When it comes to heart health, safer tools include a resting EKG or a coronary calcium scan. These options are quick, non-invasive, and provide reliable insights without pushing patients into invasive procedures. For many older adults, such focused testing is enough to guide treatment decisions. And for colon cancer screening, stool-based tests such as the FIT test or Cologuard are excellent alternatives. They can be done at home, require no sedation, and still catch most cancers in time for effective treatment. For seniors without symptoms, they are safer, more comfortable, and often just as effective as colonoscopies. The key takeaway is simple. After 70, testing should be individualized, not routine. Ask your doctor whether a test will truly change your treatment plan. If the answer is unclear, it may not be worth the risk. Safer alternatives exist, and they can keep seniors healthier without unnecessary harm. Modern medicine can be life-saving when used correctly. But the truth is that the greatest protection after 70 doesn't come from endless tests. It comes from daily lifestyle choices. Unlike risky procedures, these habits strengthen the body naturally, reduce disease risk, and improve quality of life without side effects. Prevention doesn't always happen in a doctor's office. Often it starts at home. Exercise is the foundation. Weight-bearing activities such as walking, light strength training, or balance exercises not only protect bones but also reduce falls, improve circulation, and sharpen the mind. Even 20 minutes a day of gentle movement can dramatically cut risks of fractures, heart problems, and cognitive decline. For seniors, exercise is medicine, without the prescription. Nutrition plays an equally powerful role. A diet rich in leafy greens, colorful vegetables, whole grains, lean protein, and calcium sources like dairy or sardines helps maintain strength and energy. Omega-3 fats from fish or walnuts support brain health, while staying hydrated prevents fatigue and confusion that are often mistaken for illness. Simple, consistent choices at the dinner table have lifelong impact. Quality sleep is another overlooked pillar of health. Poor sleep can mimic memory loss, weaken the immune system, and raise the risk of chronic disease. Creating a calming bedtime routine, avoiding late caffeine, and keeping a consistent schedule allow the body to repair itself naturally each night. Finally, mental and social health matter just as much. Reading, puzzles, music, or learning new skills keep the brain active, while friendships and community connections protect against isolation and depression. Unlike unnecessary checkups, these habits add years of independence and joy. The message is clear. Prevention is not just about avoiding disease, it's about building a strong, fulfilling life. At 70 and beyond, lifestyle is the most powerful medicine you have. If so many of these tests cause more harm than good after 70, why are seniors still being pushed into them? The answer is complex, but part of it comes down to habit, fear, and the business of modern medicine. For decades, the medical system has trained both doctors and patients to believe that more testing always equals better care. Unfortunately, the truth is not that simple. Many doctors feel pressure to do something when patients come in with concerns, even mild ones. Ordering a scan or a test feels like taking action, even if the evidence shows it may not help. Seniors, on the other hand, are often afraid of missing something serious. When fear meets routine, unnecessary testing becomes the norm. Another factor is money. Screenings, scans, and follow-up procedures are big business. Hospitals and clinics make significant revenue from these tests, which means the system has little incentive to slow down. While most doctors truly want the best for their patients, the structure of healthcare can unintentionally push seniors into a cycle of testing that does more harm than good. The saddest part is that many seniors never realize they have a choice. They assume every test is mandatory because the doctor said so. But medicine is not one size fits all. After 70, risks and benefits shift dramatically, and what was once helpful can now be harmful. By asking questions and knowing the facts, seniors can step out of this cycle and focus on what truly matters. Tests that change outcomes, and lifestyle habits that protect health without creating new dangers. We've now uncovered the 5 health checkups that may do more harm than good after 70. Bone density scans, brain MRIs, cardiac stress tests, colonoscopies, and full-body CT scans all sound routine and protective, but the truth is far more complicated. In many cases, they create fear, trigger dangerous side effects, or push seniors into invasive treatments they never needed in the first place. This doesn't mean that all medical testing is bad. When symptoms are clear and risks are high, the right test can save lives. But routine testing in healthy older adults often shifts the balance toward harm rather than benefit. The key lesson is that medicine is not one size fits all. What works for someone at 50 may not be right at 75. And that's why informed choices are so important. Real prevention doesn't come from chasing every possible disease with risky tests. It comes from strengthening the foundations of health, staying active, eating well, sleeping deeply, and maintaining strong social and mental connections. These simple habits reduce disease risk far more effectively than many of the screenings that cause stress and harm. The next time a doctor suggests a test, ask the most important question. What will change if this test is positive? If the answer is unclear, or if the risks outweigh the benefits, it may be time to pause. Choosing wisely is not neglecting your health, it's protecting it. Remember, less can sometimes mean more. Fewer unnecessary tests, fewer harmful side effects, and more focus on living with strength, confidence, and peace of mind. At 70 and beyond, your health is too valuable to waste on fear-driven medicine. Choose wisely, live fully, and protect the years ahead with knowledge and courage.